Hey everyone, we're gonna get started shortly. Oh, here's Yvonne. Hi Yvonne, how are you?
Hi.
Good. I'm gonna make you the host right now
Okay, great.
and not have any issues. Change host. You are the host. Okay.
Okay, perfect. Let me just set up here.
Great. Awesome. And it's 8 o'clock. So actually, give me 1 second. I'm just gonna make sure I've got chat open and Q&A open before we get started. Oh, good. Tara's here. Sorry about the email I sent you 30 seconds ago, Tara, with the link, but I'm glad you got it. Okay, chat is open. Awesome. Okay. Let's get started. So welcome, everyone. I'm super excited to be here today to talk about hypnobirthing. I found out about hypnobirthing probably about 7 years ago, and I took the course and became an instructor and fell in love with it. And when I was practicing as a doula, I attended so many amazing births and was able to watch women really utilize the hypnobirthing techniques to have really amazing birth experiences. So it's something I'm super passionate about. Since then, I have retired from hypnobirthing and doula care, but I'm so excited to have Dr. Yvonne Ling on the Flourish team and here with me today. I'm going to talk a bit about her more later, but she is the hypnobirthing guru. So it's super exciting to have her here. Oh, did we miss a slide?
Oh, sorry, did I skip it? Okay.
Great. So I think most of you that have signed in, I think I know, but there's a few that I don't. So my name is Dr. Ashlyn Lanigan. I'm a naturopathic doctor and I practice in Toronto. And I've been practicing now for over 8 years, which is wild. And my main goal in life is to help women to feel amazing, and particularly around the perinatal space. So my vision is to support women to get pregnant, to flourish throughout their pregnancies, and then return to their former glory, and then some as mothers. And it was this mission, which is what brought me to create Flourish, which is my newest exciting venture. So Flourish is a physical space. Our space is in Midtown in Toronto at 1849 Yonge Street. We're going to be opening our doors mid-July, which is very exciting. We were planning for mid-May, but 2020 has thrown us a few curveballs, and pandemic was one of them. But we are operating virtually right now. And it's basically just a hub for women's health. So what I've done is over the past 8 years, I've made amazing connections with different practitioners. And also I've had 2 babies, and I'm going to have a third in September. And so what I've learned through this experience is really what are the most important things that a woman needs to really optimize her pregnancy experience and fertility and postpartum experience. And so my goal at Flourish was to bring all of those different practitioners together so that women weren't driving all over the city to go to all different kinds of appointments. So at Flourish, we have a team of badass naturopathic doctors. So I think there's 5 of us now. And a good portion of that team is your downtown doula, who Dr. Yvonne, who I'm going to introduce a bit more later, but who Yvonne is one of the owners for. So Yvonne, Olivia, and Sarah are the owners of Your Downtown Doula, and we have partnered together. So Your Downtown Doula and Flourish have partnered together so that we can offer amazing doula care, prenatal classes, lactation support, postpartum support, everything, so that pregnancy piece can be really covered. So I'm super excited about that. And we've also got pelvic floor physio, massage therapists, acupuncturists, who am I forgetting about? Therapists. So yeah, and we have an IV suite. So it's amazing. I'm super excited about it. So on to Yvonne. So Yvonne, so how it all came together is Dr. Olivia Tooby, when she was in school, she worked reception at one of the clinics that I practiced at, and we became friends. And then when she became a naturopathic doctor, She then became a doula, and I was kind of stepping away from doula care. So I started referring her my doula patients, and they would tell me how amazing their care was from Olivia and how they loved like the entire experience with her. And so I started referring her more people, and then she started Your Downtown Doula. And from there I met Sarah and Yvonne, and Yvonne is the main hypnobirthing instructor at Your Downtown Doula. So I'll let you talk a bit about yourself, Yvonne.
Okay, great. Well, thank you so much for having me, and thank you everyone for taking the time this evening. It's still so awesome outside, so I really appreciate your time sharing it with us tonight. So just like Dr. Lanigan, I also wear a bunch of hats. So I'll tell you a little bit about my, I guess, origin story, as I like to put it. So I'm a naturopathic doctor, one of the partners of Your Downtown Doula, certified hypnobirthing educator, birth doula, and also a hypnotherapist. And I've got 2 girls. And so my practice revolves around pregnancy and babies and all that stuff. Before I got focused into this area, I started off in general practice as an ND, and then eventually found my way treating fertility. So helping women and families become pregnant, helping them stay healthy during pregnancy. And then when it got close to her due date, I would say, okay, good luck, have your baby. And if you want ongoing naturopathic support, I'd be happy to see you and your baby. So sometimes I'd see the moms, sometimes I'd see the babies, but I didn't really think much about labor and childbirth until I became pregnant myself, which is usually the case. And so during my first pregnancy, one of my clients told me about hypnobirthing, which I thought sounded really interesting. I was doing hypnosis in practice at that time already. So my husband and I took the classes, and this July will be 11 years. I cannot believe I've got like a preteen. It'll be 11 years that we gave birth to our first daughter. We lived in a very small condo, so it was a home birth. It was me, my husband, our dog. We had the birth pool, which took up all our living room. And I was really happy. I was really happy with how I was able to use the hypnobirthing techniques. So I decided as soon as I could, I would become a hypnobirthing instructor. So I've been teaching hypnobirthing for more than 10 years, like 10 and a half years. So, decade. And 2 years after that first experience, it was like rinse and repeat. Gave birth to our second daughter in the same condo. We've since moved many, many times, but, again, really happy with how I was able to use the technique. So, I'm an experienced hypnobirthing mom. I'm super enthusiastic, even for as long as I've been teaching it. I think as years go on, I get even more enthusiastic about it. And I really like to share my passion in helping families really have positive births.
So awesome.
Thanks. So my message to you is that, let's take a moment to really embrace this idea or remind ourselves that we are all part of nature, right? And so all that wisdom, all that power of nature manifests through us. And so, growing a baby, growing a human being from your body is a superpower, right? I think it's just something we really don't really acknowledge or give ourselves enough credit that we have this, we're originally designed to be able to do this. And so we should trust that, if our pregnancy is going well, we're healthy, we're growing this, little human within us, that our bodies also have the same wisdom to bring our babies into the world. And so that leads me to talk about hypnobirthing.
Amazing. So this is what we're going to go over today. So, and we'll be about like somewhere between 30 and 45 minutes. So we won't keep you all night for sure. We're going to talk about what is hypnobirthing, how it works, how to have a positive birth, what to expect. Any questions at all throughout the presentation, feel free to throw them in the chat or the Q&A, whatever you're comfortable with. And from the Instagram poll I did earlier this week, we have a bunch of questions. So we'll make sure we answer all of those as well too. And then we have some really awesome bonuses for you guys for attending tonight. Don't go to the next slide. Okay, amazing. So I'm going to send, I know a bunch of you are already members of this, but I'm going to send out a link to join our private Flourish Females Facebook group. So this is a group of women who I basically either my patients or people that I've met through doing these webinars. And when I had my first baby, what I realized is I didn't have a a great network of people to ask questions to. So I was sort of the first of my friends to kind of have babies. And so this is a forum for that. So any questions that you have, feel free to post them. It's just a safe space for women to communicate about anything. All of the health practitioners at Flourish are a part of that group. So we can't give specific medical advice there, but we'll definitely, we can answer questions to the best of our ability on there as well too. And we'll be posting the webinars and all the other awesome content that we've got coming up for you. I'm also going to send a recording of this webinar in case anyone has to duck out early. Dr. Yvonne Ling is offering free discovery calls. So this is a free 15-minute call, especially if you're interested in hypnobirthing, but you're not 100% sure, or for pregnancy care or fertility or anything like that, any naturopathic medicine. Feel free to book that. So there'll be a link that you'll be able to book that. And then I'm going to let Yvonne talk about this at the end, but she has made these amazing peaceful pregnancy recordings. So this is in addition to the hypnobirthing stuff. These are recordings she's made herself, which are awesome. And so at the end, she's going to talk about those, and I'm going to send those out to everyone that's attending tonight as well, which is awesome. Thank you for those, Yvonne.
Okay, you're welcome. Okay, so let's get started. So first, let's think about this statement. I feel towards childbirth. How would you fill that out? Just take a moment to think about that. So oftentimes I hear this, right? I feel scared, nervous, uncertain, and all other synonyms, related words to this. Well, imagine feeling something entirely different. Imagine feeling relaxed, confident, positive, even enthusiastic about labor and childbirth. And I don't think these are really words we put in the same sentence, right? These words with labor and childbirth, and yet is entirely possible. And how's this possible? Well, through hypnobirthing. And so if you know nothing about it, it's basically a complete childbirth prenatal education program, as originally created by Marie Mongan, also referred to as the Mongan method. So there are a number of kind of copycat or similar programs out there, but this is kind of like the original pioneer program. And what's unique about it is it takes a non-fear-based approach. So we go over all the basics of childbirth education, right? Stages of labor and birthing, when to go to the hospital, birth plans, things like that. But we present it from a non-fear-based approach. And for some of the parents who happen to take a hospital-based prenatal class, and they've also taken hypnobirthing, they say they're really quite different, right? The language, the approach, even the assumptions made by the instructor. So I know the parents really appreciate this non-fear-based approach. And we learn a lot of techniques. So breathing exercises, visualizations, which is basically using your imagination. We also use affirmations, which you can also think of like positive statements, positive reinforcement, that kind of thing, and advanced relaxation exercises. As well, it's great for partners. I will say majority of my parents who take the classes are first-time parents, but even for the second-time parents and third-time parents, the moms want their partners to be there so that the partners are also fully prepared to support them for labor and birthing.
And this may be more important than ever right now because doulas are being allowed in hospitals, and so partners really have to step up in a bigger way than they have in the past.
That's actually a really good point. That reminds me of a group I had, and like the pandemic stuff really kind of came in full force with all the restrictions, kind of like partway through or towards the end of the class. And the moms realized, oh my gosh, my partner is the only person who can support me. And I will say afterwards, I got their birth stories, and they said like their partners were able to use all the stuff, all the techniques, all the practice we did in class, all that was like so useful and helpful for them in that situation. So yeah, thanks for bringing that up. Because the whole purpose of this program is to help you be relaxed and confident during labor and childbirth. And really, who does not deserve to feel relaxed and confident in doing anything in their lives, right? Especially labor and childbirth. And so the next question is, how does hypnobirthing work, right? So it's a very kind of structured program. So we start with understanding how the body works. And the great thing is, like, your body is perfectly designed to birth your baby, right? Just like it's perfectly designed to grow your baby. And so the beauty of the program is you're not really learning how to birth because your body knows how to do it. Basically, we're helping to match your mindset, right? So that it's working with your body and not working against it. So the next sort of thing we do in hypnobirthing is really change the way you think about childbirth. And how I like to approach it is I really want to disrupt, prenatal education and change the way we even prepare parents for childbirth. I feel like up until now, we're not really doing an adequate job preparing women for this really important, life event. And so we really have to change the way we think about it and change the way we approach it and teach it. We also want parents to be fully educated so that they feel empowered and at the very least comfortable to ask questions, have discussions with their care provider. So the pregnant woman isn't just simply a patient and her care provider is, saying, oh, you have to do this, this, and this, and you just kind of nod your head and go along, right? We want you to feel comfortable in knowing, to ask questions, especially if it doesn't sit right with you. And so it's really about empowering parents and families. And of course, a big component of hypnobirthing is the practice. So we learn these techniques in class. I do ensure that we do lots of practice in class and also emphasize the importance of practice in between classes. So there's a bit of a, homework component, but the parents tell me they enjoy practicing the exercises. So at least there's, that positive part there. And so just to go through a little bit of basics, understanding how the body works. So your uterus, right, you can think of it as having like 3 layers. And so the outermost layer, right, so on the far left here of your screen, the muscles run up and down. And they're the muscles that do the most work during labor, like the bulk of the work during labor. And so throughout pregnancy, these muscles are getting stronger. I like to say the hormones of pregnancy are like steroids for uterus muscles. So they actually get kind of jacked up, right? They get really, really strong and they do the work of what we call waves during labor. So we don't use the C word in hypnobirthing, we use the word wave. And so these muscles, they are shortening during the wave and in doing so, helping to move your baby downwards, but also, helping to open the cervix at the bottom. And then once the cervix is fully dilated, these muscles are still working to then move your baby down the vaginal path to be born. And then the innermost layer, which is the picture on the far right, these muscles run the opposite direction, right? And so they are horizontal. They're most concentrated at the bottom, which includes your cervix. So for much of your pregnancy, the cervix, which is made up of some muscle, but also this very special collagen. The cervix is firm and closed and kind of feels like the tip of your nose, right? So I invite you to tap the tip of your nose. That's kind of what a cervix feels like if you ever wondered. And then towards the end of pregnancy, as your hormones and even enzymes are changing, the cervix consistency changes. So it goes from the firmness of the tip of your nose to about the softness of your earlobe. So if you touch your earlobe, right, it's really quite different. But we're only partway there. In fact, your cervix goes paper thin. This is the exact words, these are the exact words your care provider is going to use when they check your cervix when it gets to that stage. It's like, oh, your cervix is paper thin, right? Which is really amazing. And so during labor, the job of this inner set of muscles is just to relax so that the long muscles, right, can very easily open the cervix. And then in between these 2 layers, kind of like interwoven in between, is a layer of blood vessels. And so these blood vessels are carrying blood and oxygen to your hardworking muscles. And and your baby is attached to the umbilical cord. So the umbilical cord houses 3 vessels, right? And they're bringing blood and oxygen and nutrients to your baby. And so blood vessels are just tubes of muscle. And so we want those to be fully relaxed to bring the max amount of oxygen and blood to you, to your body and your baby. And so throughout the classes with this kind of basis of understanding, we kind of build upon this information and learn different exercises and relaxation techniques, all the while keeping in mind, we want, these muscles to work together in harmony. And in order to do so, the best thing is for them to be able to relax. So that's the understanding how your body works component. And of course, throughout hypnobirthing, you want to change the way you think about childbirth. Now, this is a huge order to do so, right? Because throughout our lives, starting when we were small children, we get lots of messages about childbirth, right? Through popular media, like TV shows, movies, the language that we use around, in pregnancy, especially medicalized language. And OBs is actually, obstetricians are considered a surgical specialty. So, they learn in medical school to approach pregnancy and labor and childbirth as a series of potential risks that need to be managed, right? Which is quite different than, say, a midwife, where they are trained to see pregnancy, childbirth as a natural, normal function of the body, right? And so depending on, and I know there's cultural differences and all these things, so really influences how we end up feeling about childbirth. So I have here, a lot of people have some degree of this, right? Where they feel afraid, uncertain, anxious, out of control, right? Just the idea, the environment, what's happening, all these things. And so the question is, well, in this previous slide here, I just talked about just being relaxed, right? It's like, I can handle that. Like, I just need to relax. Well, if these are the thoughts you have about childbirth to begin with, it's going to be really hard to relax when you're in it, right? So childbirth, labor is such a primal activity of the body that all kind of really, the conscious, rational, executive thinking kind of goes out the window. So it is really important then to implement, a kind of habit you have or an automatic response that you'll be able to create during labor. And so this is what we try to do, right? We want to transform all that fear and worry, anxiety, and all those thoughts into something more positive, right? Where you feel confident, prepared, and wouldn't you love to feel like this person here during childbirth? Like I picked this picture thinking like, if she just gave birth and, and you could maybe in your mind picture holding her baby, like we should all feel like rock stars after we give birth, right? And we all should feel like queens during the whole process. And this is really the transformation we want to help pregnant people make when they are, preparing for childbirth. And so, of course, the big question people ask me is, does it work, right? Some people like to, they want hard numbers or evidence and all this stuff. And the way I see it is hypnobirthing is more about acquiring a skill or a technique, much like if you're learning how to ride a bike or learning how to swim, right? So, if you put in the time, you get into the pool, you're practicing your strokes and whatnot, eventually you'll be able to swim, right? And so, asking about percentages and effectiveness and all this stuff, I feel doesn't really apply when we talk about hypnobirthing. However, they did try to collect some numbers. And so the HypnoBirthing Institute is based in the States, and they sort of oversee like the training, and they produce all the materials. And so hypnobirthing is like taught in over 50 countries, something like that around the world. And so with the information they gathered from their hypnobirthing parents, they compared it to a survey also conducted in the States where they got information from women who birth conventionally, meaning they didn't take this kind of preparatory course. And so compared to conventional births, hypnobirthing parents do report reduced use of interventions. So this includes the use of epidural, as well as things like inductions, even C-sections. And it's a significant number. We're not just talking about, 5%, 10%. We're talking anywhere between 20 to 40% in reduction. And in some of these cases, parents also report shorter duration of labor. Over the years, I've collected lots of stories from parents who've taken the classes, and some of these stories have sort of common themes where the doctor or the midwife were really surprised by how progressed mom's labor was, right? So like she shows up at the hospital or, meets the midwife, and the care provider thinks, oh yeah, you're still in early labor, or you seem like too relaxed, too calm. And then when they finally check her and realize, oh gosh, you're already, 7, 8, 9 centimeters dilated, that really says something when you surprise these people, these staff who do this all the time. And so, yes, so some moms will report shorter duration of labor, which is always a good thing. Helps to reduce postnatal blues, helps to reduce the incidence of postpartum depression. We are teaching techniques essentially in how to deal with stress in a specific like childbirth context, but oftentimes the parents will use those same techniques in those early days, weeks, months, years. I think I'm still using some of these techniques, right, when it comes to parenting. And so that's something we've sort of seen as like a secondary benefit out of hypnobirthing. And most definitely, we see increased reporting and increased satisfaction with the birth experience. We also know, just from general studies about pain and approaches to them, that hypnosis, generally speaking, and methods of relaxation are effective in approaching or treating or reducing acute and chronic pain, right? And so we do, if you want evidence, we have evidence for these things. But just don't take my word for it. Some parents, they've submitted their birth stories and have really, realized some very impactful things for their own experiences. So Shirley, I remember her and her husband. Shirley was a little bit on the shy side, and this was like about 3 years ago. It was her first pregnancy, having their first baby, I believe, was with an OB in hospital. And so she says, I was afraid of labor itself, but I can tell you I'm not anymore. Hypnobirthing gave me the confidence I lacked, and I gave birth without any interventions and with ease. Like, that's a pretty amazing quote right there, right? And so I do remember her story because I used to share it in the classes, she woke up one morning, she felt some weird kind of cramping, thought it was something weird she ate earlier that day. And so anyway, she went to work. After work, she went shopping. Then she got home, ate dinner, watched some TV, went to sleep, all the while sort of feeling, she thought it was Braxton Hicks or something like that. And then she woke up at around like midnight and like in labor. And because I believe she was like 37 and a half weeks, they hadn't actually packed yet. And so she's doing the breathing, in bed and all, she's really focused on doing all the hypnobirthing stuff while she told her husband to run around packing stuff. And like just a couple hours later, they had their baby. And so it was really amazing. That was a really amazing story from Shirley. Another story I got, this one's more recent, is Norlene. So Norlene wrote, I'm so proud of myself. The doctor and the nurse at the hospital were surprised that I did not take the epidural. The doctor even asked me how I did it without an epidural, right? My baby's birth was an amazing experience. So in this one, I remember Norlene and her husband took the classes before Christmas. And in her story, they were enjoying Chinese New Year festivities. So they, went to lunch with friends. And throughout the day, she started getting kind of these signs that maybe something was happening. Now, it's funny because actually Norlene's husband was very nervous. He was very nervous. Actually, I think he was more nervous than Norlene about, labor and when to go to the hospital. So she actually spent the whole day and did not tell her husband. right? So in this story, she's talking about how like she noticed she had some birth show, you know, like the mucus plug, and she was kind of feeling what might be like early labor waves and things like that. And it wasn't until they had gone to bed and then she woke up again because they're getting stronger that she finally told her told her husband. And then, you know, then they went to the hospital, and of course she had an amazing experience. Also amazing, you know, amazed her own healthcare providers. Then we've got Sarah's birth story. So Sarah and Tom, they took the class with me with their first pregnancy about 4 years ago. And then more recently, last spring, they took the classes with me again, more like a review for their second pregnancy. And so for the first time, I'm going to tell about her first experience. They were planning hospital birth with an OB. And what happened was they had woke up one morning, and a lot of these stories start the same way, right? She woke up one morning, sort of felt some cramping, wasn't sure what was happening. And so she had her OB appointment that morning. So they went by subway. They live right downtown, to the OB appointment. And the OB actually checked her cervix and found out she was about 2 centimeters dilated. So the OB said, well, this could mean, you know, labor will start tonight or in a week or two, right? And that's how it is. It's very unpredictable. And so they went home, and she proceeded the rest of her day doing errands and, you know, doing things around the house and that sort of thing. And things really started to pick up, I guess, with the labor pattern. And so at some point, you know, she wasn't really sure what to do. So she called the hospital, but of course, you know, her cell phone couldn't get good reception. So the hospital kind of said, just come to the hospital. So they made their way to the hospital. You know, they made her wait because she seemed to be still in early labor. And then when they finally got to triage, and finally when a doctor checked her, found out she was 8 centimeters dilated. Okay, that's pretty amazing to be that far progressed. And so, you know, they rushed her finally to her own labor and delivery room. And she said the rest of it, you know, she basically used the techniques throughout. Her husband was a really great support, doing massage, reminding her to keep focused, things like that. And so 2 hours after they arrived at the hospital, she gave birth to their daughter. So another amazing story. And, you know, I've got a whole stack of these, right? And it's just really great. And so you too can also have like a really amazing birth. They don't have to sound like these ones, that's for sure. Everyone will make choices that are right for them. I certainly get parents who choose, you know, to get an epidural, or parents who have to have interventions, things like that, but they will say that hypnobirthing was still so really helpful for them.
Because either way, right, like that initial phase of labor, most of the time it's too early to get an epidural. So you need some coping techniques ahead of time as well too.
Yes, that is a huge component I think is really missing, because it's so different. We are so conditioned, like people don't realize the social conditioning we have when it comes to childbirth. A lot of our exposure for the average person is what we see in movies, right? And what do we see in movies? Happily eating lunch, suddenly water breaks, the waiter got wet, you know, or whatever. You rush off to the hospital. There's all this straining and screaming and whatnot involved, and then there's a baby. And people don't realize that's really, I mean, I've really not been to a birth that even looks like that, right? And so, yeah, the whole thing with the epidural. So these are really common questions I've got listed here about like, who is hypnobirthing good for? And of course, I'm going to say it's good for everyone, but let me be specific. So should I learn hypnobirthing if I plan to get an epidural? My answer is yes, but I'm going to explain why. And Dr. Lanigan sort of hinted to it, that people don't realize you're instructed to go to the hospital or call your midwife when you are in active labor, meaning the labor has been well established, it's predictable, you know, the waves themselves is strong, that kind of thing. Which means there may be a long stretch of time, right? If it's like early labor, which is the longest part of labor, potentially, there's a long stretch of time where you're at home waiting for things to progress. And so it's always really helpful to have some techniques to cope during that time. And if, say, you went to the hospital And yeah, if you're too early, so if your cervix, like the definition of active labor or what's too early is if the cervix is less than 4 centimeters, 4 or 5 centimeters dilated, right? And so if you go to the hospital, you feel like, oh my gosh, things are happening, whatever, and they check you and you're 2, they're going to say, oh, it's too early. Wait here at the hospital. Like they'll say, wait here at the hospital, walk up and down the hallways, you know, that kind of thing. And if you've really not had any kind of, you know, coping mechanisms because you thought, oh, I'm just going to get an epidural, you know, that time waiting until you get active enough, that can be a really difficult time. So most certainly hypnobirthing will equip you with, you know, good coping mechanisms to get you to when, you know, up until you are then able to sort of get epidural if that's what you end up choosing for yourself. Should I learn hypnobirthing if I might get induced? And so, you know, some pregnancies, there are medical situations, for example, gestational diabetes, or depends on individual factors of the pregnant person. And so they might anticipate at some point they might get induced, meaning their labor will start artificially if it doesn't start naturally. And I would say, you know, if you're facing medical interventions, hypnobirthing applies maybe even more so. Because when these medical things are are happening to you or being done to you, you can feel very vulnerable. Those feelings of uncertainty, feeling out of control, those things can be heightened. So again, it would be really useful and beneficial to have a set of techniques or tools to really help you through that. And then if your partner has learned all these techniques as well, they can be there to remind you or do those things with you. Should I learn hypnobirthing if I have a high-risk pregnancy? Well, it's the same answer, yes. Yeah, so I do get twins. I've had parents expecting twins in my class, so unfortunately those are categorized as high risk. Some families, yeah, pregnancy with special circumstances, things like that. Again, oftentimes actually the reason they want to take hypnobirthing is to help them stay relaxed and calm during their pregnancy and for childbirth, especially if they anticipate, say, more interventions. So it's certainly not just reserved for the families or parents who want to have a natural birth. I would say it might actually be split, like with the parents who sign up for my classes, it might be split down the middle. Those parents who want to have natural home births, certainly hypnobirthing is really great for that. But then for the other parents who, you know, where they might anticipate or they might be afraid of, you know, there's going to be interventions or, yeah, I'm going to get an epidural, but I know I'm going to be, you know, laboring at home for a long time or whatever. You know, half of my classes are those parents as well. This last question, should I learn hypnobirthing if I'm getting a C-section? If the situation is that you start off having labor and it ends up being, say, an unexpected or an emergency C-section, then hypnobirthing will be really helpful. The techniques will be helpful to help you stay calm and relax as much as possible during that whole process, right? It can be quite a roller coaster to go through labor and then find out, you know, something's going on and then it ends up being a C-section. So I would say yes. I mean, of course, that situation you can't, you know, anticipate or plan for. Now, if it's going to be a scheduled C-section, so for example, if the baby's breech or there's some situation where, you know that you won't be giving birth vaginally, it will be a scheduled C-section, then perhaps the entire hypnobirthing course may not be appropriate. However, there's always a possibility for tailored or private sessions for your unique situation. And that's something sort of get more into when we talk about the classes themselves. And so these are the really common questions, and maybe you guys have questions too, which we'll go over at the end. And so I like to say that hypnobirthing makes a difference at every birth. And I truly believe this, and I witnessed this. As a doula, 99% of my clients go through hypnobirthing. But every family will benefit differently from hypnobirthing. And so in the birth stories I get, right, and you guys got some of the quotes from before, right, moms were afraid of birth before and afterwards are feeling much more confident. Like, that's huge. But some of the other stories, the moms will say, hypnobirthing helped my partner be a really great birth partner. I think that's really fantastic. Or hypnobirthing helped us make choices, like our birth choices. So I've had some parents, they decide to have a home birth instead of go to the hospital, or they decide to change, they had the courage or the knowledge to change care providers because they did not feel comfortable with their original care provider. And these are really great, right? If hypnobirthing can help you in that, in a way that benefits you most, then, you know, you're getting what you need out of hypnobirthing. And so just to get into the nuts and bolts with the classes, what to expect, the program is very comprehensive. It's 5 weekly classes, 2.5 hours each, jam-packed with information, and we do exercises and all that each class. It is small groups. I do try to cap it at a specific number. The program also includes textbook, a parent's workbook, and 5 like official hypnobirthing recordings. I'm also kind of bundling things up where you also get a general naturopathic consult just to kind of optimize your pregnancy health. I make sure there's lots of in-class practice. Like I said, I really want to make sure by the end, everyone feels really confident in the techniques. And it's suggested that you start when you're about 32 weeks or earlier in your pregnancy because, you know, your baby could arrive anytime after 37 weeks. So I want to make sure that you're able to get all the information and practice in before that time. And like I mentioned before, private classes are available.
Yeah, and I'll just talk a little bit about, so we're going to be running 2 hypnobirthing group courses at Flourish. They're both going to be in August. We had obviously planned to run these at Flourish, but right now our game plan is virtual classes. We're still capping it, so we try to cap it at 6 couples, and that way it keeps it as a really small, intimate group. Everyone's comfortable asking questions. You get to know all the people in the class as well too. So even though it's virtual, we're still capping it at 6 couples. So we're doing a Wednesday evening class, which is 7:15 to 9:45 on August 5th, 12th, 19th, 26th, September 2nd. And we're also doing a Sunday morning class, which is 10:30 a.m. till 1 p.m. from August 9th to September 13th. There is, I think, Labor Day. Is that what falls?
Yeah, that's the gap. Because, you know, I like to take a break.
Yeah, totally. So
yeah.
There's just make notes of those dates. We also too, because I know there are a couple people here that are about ready to pop, and so I'm not sure if they have already done hypnobirthing and they're just coming to this webinar for like general info. But there's always options to do private classes and like a bit of a crash course where Yvonne can kind of tailor it more specifically to your needs as well too. So that's always an option as well. But our regular traditional class, the cost is $475, which might be like some sticker shock for people. But what's amazing is that because Yvonne teaches it, we bill it as naturopathic medicine, and it can be put into the partner's name or the mom's name. So whatever is easier for you. Obviously the partner needs to attend the courses for it to be in their name. And it also includes a 30-minute visit with Yvonne. So that can be, I'm not sure when I ran the course, I used to do it at the end, and then I would talk to people with their birth plans and that type of thing. But what's awesome is you have a one-on-one time with Yvonne too. So if there's something that you're not comfortable discussing in the group, then you can do that as well. And that $475 is split up over the 5 classes. So there's usually, if you have insurance coverage, it is quite awesome because you can usually get most, if not all of it, covered with insurance. So because we're capping it at 6 couples, I remember when I was running classes, and same with your downtown doula, they always fill up. So space is quite limited. So if you're interested, all you need to do is just send me an email. So I have a variety of different emails, but my newest is ashlyn@flourisherhealth.com. So feel free to send me an email, and then I'll make sure that you're on the list for one of those courses. And as I mentioned at the beginning, if you're going to have like a 3-month-old baby by then, that's totally fine. There are private classes and crash courses if you feel like this is something that would be really great for you, that we can organize too. So just let me know if that's something that you're interested in. Amazing. So we have a bunch of questions from your IG poll. So I'm going to let Yvonne go for most of these. So how does it differ? How does hypnobirthing differ with Lamaze?
Yeah, so Lamaze, I haven't heard that name in a while. So, you know, if you've watched, say, older movies or whatever, this term Lamaze has come up. I mean, it is an organization, it's Lamaze International. And I guess they're one of the pioneers that came up with like the idea of special kind of breathing and relaxation and whatnot. I will have to say though, you know, there's been a lot of changes in how we approach relaxation during labor and birthing, like different breathing exercises, different relaxation. So while the goal or the purpose might be the same, I would say hypnobirthing is a little bit more current on, you know, keeping up with like evidence and things like that. So, but otherwise, I mean, it is another method of, you know, relaxation during labor and childbirth. The next question, yeah, so some of these I touched upon. When's the best time in pregnancy? So yeah, 32 weeks or earlier, because the classes span across 5 weeks. Now, sometimes people will reach me. They'll say, oh, I just heard about hypnobirthing and I'm already 38 weeks pregnant. You know, I've been doing this for a while, so I am able to do sort of like very individualized or tailored classes. They would still also be virtual, just for the safety of everyone. And to be honest, I think now people really kind of like I do the class, I've done a few now virtually, and they've gone actually quite well. And I think people like just being able to hang out at home, especially the Sunday morning group. I think half of them are like in their pajamas and their pets are there and they're having all their snacks, you know, by their side. And then when we do the exercises, they're lying down on their couch. So in some ways, the virtual format is working quite well. But yeah, if you find you're kind of time crunched, there's always ways to get those techniques in. The epidural, so yeah, we went into that, and regardless of what your choices are for yourself during childbirth, regardless of your pregnancy situation, who your care provider is, your birth location, you know, there is something from hypnobirthing that will be of benefit to you. Do I need to take other birth preparation classes? I would say the answer is no. So even though, you know, it's a time and resource commitment, it's really the only class you need to take. You're not required to take another class. I would say in terms of the basic, you know, childbirth education aspect, it probably overlaps with your traditional hospital class, you know, by about 90%. You know, we don't cover we don't get into specifics of C-sections or epidurals, that kind of thing. But because I am a doula, usually if parents have questions about that, I'm open to fielding questions about that, like outside of the class. But otherwise, no, you don't have to take another type of prenatal class.
I just, for general a note. When I was pregnant with my first baby, I did a variety of different prenatal classes as like research. So I did the prenatal class that my midwives ran out of their clinic. I did the one that was out of the hospital that was like affiliated with the clinic. And then I literally taught a hypnobirthing class that I made my husband attend at the time. And Jake will tell you that like by far the most comprehensive, he's like, the only thing that we really needed was the hypnobirthing stuff. Like it's any of the kind of information stuff that you learn through a hospital course or otherwise, you're getting from hypnobirthing, plus you're getting like what you actually need to do during labor. So you definitely don't need another course.
That's so funny. I only took hypnobirthing. I was like, I'm not gonna my time is precious. I wasn't going to run around
crazy.
town
Yeah.
taking different classes. Yeah. You know, and I know your time is precious, right? All you women out there.
Yep.
Does your partner need to learn hypnobirthing? Yes. Okay, your partner needs to be, if your well, I should qualify that a bit. If your partner is the one who's going to be your support person, right? If they're the one who's going to be there, then yes. So whoever is going to be there supporting you during labor should be the one learning the hypnobirthing techniques. Especially, you know, in the current situation where they do have restrictions in the hospital setting. If you've got you're only allowed one person, you want to make sure that person knows, you know, everything they need to know to support you in the best way possible. And the last question, I don't know if it's a serious question. Will someone sit next to me during birth dangling a pocket watch? I don't. Do I look like the kind of person who's going to dangle a pocket watch in front of you? No. I mean, unless you think that's going to be helpful for you, by all means, you can do that. I'm all for free choice. But but no, I mean, we take a modern approach to hypnosis. And I mean, even with hypnosis, there's a lot of misconceptions about it. But in its essence, hypnosis is basically a state where you are relaxed and focused. Like we've all experienced some form of hypnosis, we just don't call it that. I don't want to get too much into it, but yeah, no crystals, no pocket watches.
Amazing.
Were there any other questions?
No, I don't think so. Don't think there are any other questions.
All right.
Yeah, just let us know if there are. This is my little fin.
Oh,
I can't do a presentation without showing my.
They are super cute, these kids of yours.
So do remember to take advantage of our bonus offers and let me know if you're interested in registering for the hypnobirthing class. And then just a reminder, so I'm going to send out a link for the Flourish Females Facebook group, the recorded webinar. Feel free to book a discovery call with Yvonne if you're intrigued about any of this stuff or you just are interested in working with Yvonne. And then I'm going to let you talk a bit about your pregnancy, peaceful pregnancy recordings.
Yeah, I'm really excited that that I was able to do this. So the peaceful pregnancy, just a little background, where I mean, it's fresh out of the recording studio, I guess you could say. I created this out of what I saw was a necessity in the current situation. So I just cannot imagine being pregnant during this time. And YDD hosted a Facebook a week where we were talking about busting fears, childbirth fears. And this was kind of in the height of the lockdowns, and like suddenly all the restrictions were in place at the hospital, and it really kind of turned everything upside down. Pregnancy care was scaled back, supports, you know, for families were scaled back, and just lots of stress. So out of that, I created Peaceful Pregnancy. So it is a series of 5 original recordings. They are completely separate from hypnobirthing. I am a certified hypnotherapist, so I use my own experience and knowledge to create these aimed at reducing stress. So it's a mixture of like kind of like general relaxation, but there's a couple in there that help you kind of release like we call them in hypnosis, we call them like emotion release and things like that. So we've got a couple exercises revolving around there. I've also got one to sort of help uplift you and stuff. So it's a real range just to really bring peace to your pregnancy experience and really help to normalize it as much as possible under these abnormal times, right? I feel like some aspect of the pregnancy experience is being robbed because of all the stuff is going on. So we really want to return that back to your pregnancy experience. So that's really what these recordings are about. The feedback's been really great. I've had some clients purchase, they are available for purchase normally. And so clients who've also taken hypnobirthing got these additional recordings, and the feedback's been really good. So I'm so happy to be able to offer them to the audience today.
Yeah, it's so generous. So yeah, Yvonne she sells these through your Downtown Doula, but everyone that's attending today and that registered for the class, I'm going to send it an email with a link from Yvonne, and you'll be able to access those recordings and listen to them at home. So thank you so much, Yvonne. Such an awesome gift. Amazing. Okay. I think that is everything we have for you today. So, again, I'm going to send out an email with a bit of a recap, but if you have any questions or concerns or anything, feel free. I'll have Yvonne's email will be on there as well too. So you can always reach out to her as well. And thank you so much for attending. We're going to take a little bit of a break from our weekly webinars just for a couple of weeks. We decided to run this one tonight, despite what was I didn't want to take away from the important things that are happening in the world, but we had so many people registered for it. And so we decided to run tonight, but we're going to take a bit of a break from our weekly webinars for the next couple weeks to try to put the focus on where it needs to be right now. So thank you so much, everyone, for attending. And thank you, Yvonne. You're amazing.
Oh, you're welcome. It was my pleasure.
Great. I hope everyone on here does it, and have a wonderful night. Thanks, guys.
Okay, bye.
Bye.